So just before we even go into the patient's rooms, we'll always check the policy and procedure and the doctor's order to make sure, and the MAR to make sure everything matches.
Here's some hand sanitizer.
Just wash my hands before I go into a client's room, always.
No, but like you can go back there. Otherwise, we would use like
Hello, I'm Melissa. I'm your nurse today. Your student nurse.
Someone was like, oh, you're too much in there.
Bart Lyons.
Okay.
But that's the case.
And
That's
the Bart Lyons.
So it's,
And what's your date of birth?
yeah.
It's okay.
Everything matches?
Good.
Okay. We have a doctor's order here to give you a unit of blood because you're losing a little bit, your hemoglobin's low after your appendix was taken out.
That and that
So
was somebody emailed me
we're gonna
about
do
that
that
one too.
today. Have you ever had a blood transfusion before?
Yes.
Okay, how many times?
Like we told them like
Once.
that one.
Just once? Okay.
So
The
you
reason
just
we
like
ask
it.
is
So you
because
just
every
would
time
just
you have multiple, you have a higher
get
chance of
yeah,
reactions
because
during those transfusions. Did you have any reactions?
No.
Do you have any allergies?
Moist
Blueberries.
So the
Okay, and how
just
are you
kind of
feeling
getting
right
the
now?
Exactly.
Feeling okay.
And they call it wicked
Okay.
in your textbook.
Okay.
Before we get started, it is very important, we're gonna take a set of vitals just to make sure that, you're okay to have blood. And I'm checking the site to make sure that it's patent, and in a few minutes, I'm going to flush it just to make sure that it's
Like even just
all in
this,
the right
like this
spot.
is
So
still
Skyler here is going to take your vitals.
Yeah.
Yeah.
So we've got his blood pressure cuff on properly. Alright.
But yeah, like
Alright, so I've just done his baseline vitals and now Melissa's going to check his chest sounds.
Yeah, don't want you. Are we? Well, did very low. Can you take a deep breath?
No,
You'd
because
so much
I would
after
be
your
disappointed with me, right? Because I
Okay,
was
we're
having issues.
I'm checking the IV site, I'm also checking for any swelling, redness, or and to make sure that the IV is still intact.
We all did very well.
So after I did like my little physical assessment with all the baseline vitals and respirations and everything, I would be filling that out in his cumulative blood product record here, just to make sure that we have the baseline before he receives any blood products.
Alright, so I'm back in the room and I'm going to hang the saline and I'm gonna wash my hands beforehand. Alright, and we've got our supplies here. So we've got our Y tubing solution set and we've got our 250 ml bag of normal saline. And I wanna check on both bags the expiration date, and I wanna see if there's any condensation or damage to the saline before I hang it. And also, before, or in case there's any reaction, we have a 1 liter bag of saline, just in case.
And also I have checked to make sure that there was an informed consent form and all the papers are properly signed before we will even go get blood.
Or even, yeah, or even just like collecting urine and putting it into like a bottle or something. That's pretty.
So spike the bag, making sure that the spike was sterile while I put in the bag. And yeah, and all of the clamps are closed right now, so that it's not just running through.
To make sure before we hang the saline, I'm going to make sure that it's patent by flushing, so I'm just going to wash my hands. And since it's a very possibility that I could be touching blood, and it's always important to wear gloves. Okay, this has already been primed. And to prevent any organisms or anything, we always swab our end here just to prevent. And before I get started, I'm just gonna aspirate a little bit to make sure there was blood return. Okay, and there was, so now I'm gonna go 3 to 5 mLs. Okay.
So I'm back back in the science room and I'm washing my hands again. I'm just about to prime the line with normal
It
saline.
was like squeeze, release, close, and I was like, I don't know what that was either.
That was the
Yeah. Something. There's a couple I was like, I don't think this kind of. But then I just like.
It was that the first or second?
The first.
Then it's underneath here, cause if
So
you
that
go
answer
like this,
could be right, that's potentially.
then you're contaminating your whole inside of your cup.
And I considered it this. Like when you're, you know, when you're.
So the reason Skyler was using this special spike dual set was just because like it's one's for the blood and one's for the normal saline, so it's specifically for that, and it allows for like thicker drops. And we always use a pump. We can't use a drip factor because it's just can't. We always have to make sure that we're monitoring specifically on what's going in the patient. And yeah, and we always prime with normal saline.
Alright, I've just finished priming the line, making sure there's no bubbles, and now I'm going to connect it to the patient's extension. So I've got my alcohol swab to swab the port, just so that we can prevent any infection of bacteria getting in there.
Wait, you let me know when that rewriting.
Okay, I'm gonna go and do some stuff.
Making sure I'm not touching.
What were you guys practicing?
And if you were to ever
And then I
prime
come
with
in for
anything other than normal saline, hemolysis could occur. To go get the blood, we have to make sure we fax the request for release of blood. So it would be this form, and we'd make sure that the ward's phone number was on there, who the ordering physician was, what the reason for the blood was, and how much. And also the doctor's order, so we're gonna do that, and then 2 nurses need to go down there to get it.
Alright, so we would have washed our hands again before we enter the room. Oh, thank you. No, sorry, I guess I can't just. Perfect.
Hello, Mr. Lyons, we're back with your blood. Okay.
Alright, so we're going to do our checks to our different forms to make sure that it's been transcribed properly to all sheets.
Okay, so which one are we gonna start with?
So first we're going to do his ID band to the record of transfusion.
Okay.
Alright. Okay, so I have Bart Lyons, B-A-R-T-L-Y-O-N-S.
Okay, Bart Lyons, B-A-R-T-L-Y-O-N-S.
And his VIN number is 928-540-734.
Okay, 928-540-734.
His date of birth is March 30th, 1958.
March 30th, 1958.
And it's Dr. Melville.
Dr. Melville. Good. All right.
And then
Now we're going to compare record of transfusion to his tag here. Okay, so we have Bart Lyons, B-A-R-T-L-Y-O-N-S.
Bart Lyons, B-A-R-T-L-Y-O-N-S.
Okay, and he is, his VIN number is 928-540-734.
928-540-734.
Okay, and he is B positive,
B positive.
and the physician is Dr. Melville.
Yep, Dr. Melville.
Okay,
And then
and his medical record number is 681834.
681834.
Okay,
And then the donor information.
and the donor information is, and it expires October 30th, 2018
At midnight.
at midnight. Okay, and they are compatible, the cross match, and the donation number is C0540-196-4234N.
C0540-196-4234N.
Okay, so now I'm gonna check this bag, and before I do anything, I'm gonna make sure it's a good bag. It's not cloudiness, there's no punctures, it's not expired, and there's no visible damage to it. And so there, I'll are good. Now I'm going to match this bag to this. Okay, so I have blood here, B positive blood.
Be positive.
Okay, and it expires October 30th, 2018. It's red blood cells.
Mm-hmm.
Okay, and the number, what do you call that number? Sorry, you can crop
The
that out.
donation number?
Is that it?
Yeah, that's the donation
Okay,
number.
the donation number is C0540196423
Yeah, the donation number is C0540196423
Okay,
Perfect.
very good match.
Alright, so now we can hang this.
Okay, and on hand, I also have, in case there's any reaction, so I would already have the transfusion reaction algorithm on hand so that I know what I'm looking for. Okay. Okay, so now I'm going to hang the blood, and anytime I'm dealing with blood products, I'm always going to wash my hands and put some gloves on. Okay. Just making sure that's clamped. Okay.
Yeah, making sure the spikes
Yep.
remain sterile.
Okay.
Good.
Okay. So now I can unclamp.
And let it roll. The bottom might be clamped.
Okay.
Alright, so now I'm going to set the rate of the blood, and so for the first 15 minutes I'm going to set it at 50 mLs per hour because that's usually when the adverse reactions happen within the blood, and then after that I'm going to set it to the doctor's orders, which is 125 mLs per hour over 4 hours. And so it's the volume of the bag divided by
How many
hours. Alright, so we're going to start at 50.
And we have to make sure that that bag is infusing within 30 minutes of the removal of fridge to promote integrity of the blood.
Alright, perfect. Okay, so, I gotta unclamp. So that, otherwise it's going to occlude. Alright, and it's running.
Okay.
And then
So,
for the first 15 minutes, we wanna stay with the patient.
yeah, we're gonna be looking for fever, chills, any respiratory distress, and any lower back pain, nausea, and pain at the infusion site. And we're always checking the site
Yeah.
where it's being, like, that's just what we're always gonna be doing for any infiltration or like if the site comes out or anything. After that we hang the blood, we would both sign, double sign where it says 2 initials and the lot number, the time we hung it, and the ID, and we would, this is where we're going to be recording all our vital signs, and we would also fill out the in and out. We're still keeping it, since we're still within the first 15 minutes, we're still checking Bart, making sure that he's not having, so I'm gonna take his temperature, which I don't have a temperature here, but, or she does, and we're gonna do the O2 stats and run his vitals.
And then check his blood pressure.
Definitely doing his temperature here with my thermometer that I don't really have, but his temperature is good. He does not have a fever.
And chest sound.
Chest sounds are good. So after 15 minutes, we've come to the conclusion that he is doing really well with his transfusion. So we can now change the rate to the doctor prescribed rate on here. Okay. Okay. Alright, we're good.
Alright.
So I've changed the rate to 125 per hour. Okay, so after 15 minutes we can go, but then we're gonna have to come back in another 15 minutes. So now it's been 15 minutes since I've taken the initial, like after I left, so we come back in another 15 minutes.
Mhm.
So I'll check him to make sure he's good. We're gonna do all the vitals again, temperature, respirations, everything. And if he's good, I can leave him again. And then after we can come back every 30 minutes until the end, and then an hour after. Each time that we've taken his vitals, we are gonna make sure that we mark it on the cumulative blood product record here. Okay.
All right, and now we've left the patient's room, so we're going to wash our hands again.
And we also made sure that Bart will let us know, ring his bell if he's feeling anything uncomfortable. We described all the different reactions that could possibly go wrong with this, so he's been informed.
All right, so we would need to have transfused the blood within 4 hours of hanging the bag, and then if there's any reaction, then we would need to stop the transfusion and immediately start the backup 1 liter bag of normal saline and call the doctor.
Okay, so after his blood transfusion is complete, like at the very end and it's all done, we would also flush out, because just to make sure that he gets all the blood, so we would flush it with normal saline.